Great. So welcome again. I'm Doug Thompson, the founder of Inside the Wellness Dentistry Network and the founder of the Wellness Dentistry Network. And it's really all of you, my friends, and my dental colleagues across the world, actually, that have made a dream of mine become a reality. And that is to help people understand how to integrate wellness concepts into our restorative practices or into our professional medical practices. It's really, really a joy. So I want to thank all the WDM members and all the teams that are out there. I know that one of the things that I've shared with you before, if you haven't heard it, is that we had a vision to create this environment, this global environment amongst all of our professionals to really achieve some excellence and distinction in not only implementing comprehensive dental care, which is important to us, but I wanted it to positively impact whole body health. And man, have I learned a lot from all of you, and we've learned a lot from each other along the way. It's really, really exciting. And the idea behind this concept is it should be timeless with no regional boundaries. And that, in fact, is what's happening, because we have offices in Italy, offices in Canada, offices in Australia, offices in the UK, as well as many offices in the United States. So that's fantastic. And what we're really trying to do is help practitioners implement these strategies. However, we're all tied to teams. So we need to have teams help us deliver this comprehensive oral care that we do that positively impacts health. And we want to do this in a patient-friendly environment. But the key is we have to grow and we have to network. Networking together is going to be the only way we can really build a strong community. We need to stay in touch with each other. And I need your help in giving me suggestions on how to do this, because this is one of the areas that we haven't been as successful as we want to be successful in the future. And so we have to build a community. So we're thinking about different ways of doing that. So the intent of these webinars is really to help show examples of the actual tools that we've created and what we're doing to utilize these tools inside the Wellness Dentistry Network, because you have this resource material. But if you're not using it, or if your team's not using it, then the resource material is really not worth anything. So we need to figure out how to make it better, how to figure out what we use, and how to benefit from using it. I want to make sure that we can address questions from your team. So please jot down questions, send them to us. I'm going to give you the address at the end for how to do that, or even throughout how to do that. But send those to us. Because it will really help us give you and help you with what you're struggling with the most. And then the intent of these webinars are also to help us stay current. We were having and thought about having monthly or yearly meetings where we all got together. And these are really a burden on scheduling. It's tough to get everybody together. There's so many meetings to compete with. So we're going to decide to have rallies every 2 years, most likely the first weekend in May. And that'll be the first weekend in May of 2020. We're looking at that right now, and the formal date will be announced soon. We also want to create a methodology to have content updated and looking for tips and tricks and things that people are doing. So we want to have ways of doing that, and we're going to have these come up into our inboxes, into our mailbox. And we want to have through the MailChimp or some of these other venues that we have. And then again, I want to remind everybody to have their team and you sign up for our closed discussion group. There's a closed discussion group on Facebook. I realize some people don't want to use Facebook, so we have created a member forum that will be launching soon that will help. So we'll have 2 avenues for that. So that's on a day-to-day, not a month-to-month. So again, either ask us for an invite, have your teams ask us for an invite to the Facebook. We have a lot of assistants and hygienists on Facebook. We're well over 100, and then ask for you to, when we get the Google group going, we'll make sure you get invited. So that'll be great. So team member benefits. One of the things that we hope that the Wellness Dentistry Network will do for team members is it'll make the education process easier. I know how hard it is to come back from a meeting and try to share with my team what's happening. So we want to make the education process easier. And what we hope this will do is it will help our team members develop professionally. when they develop professionally, maybe they can become department leaders, maybe they can have more, they can take on more. We have opportunities for coaching in dietary management, coaching in many different areas that we're networking with other professionals. We know that as we discuss this in our practice, we create patient loyalty. When we create patient loyalty and we develop professionally, we have more joy in our work. And that's the idea. We want to have more fun doing what we're doing. And again, we want the team members to use the resources to start the journey. But remember, I want to advise everyone to really start slowly. So depending upon where you are in your journey with this material, you have to start slowly. And I would like everyone just to define 1 or 2 objectives of how to move forward from where you are now. And not a lot, just 1 or 2. We want to really try to keep it as simple as we can. That's really the idea. So there's 3 main C's of WDN. We call it the 3 C's of WDN. It's our content, that content that's growing and never ending and continuing to expand. We know the content is not only WDN generated, but member generated. I have many people come to me and say, hey, I have this great idea. What do you think about this? And it makes its way into our network. We want our network content to expand, but to expand in a categorized way so that it builds on each other, so people know when they come in where to start, and people know where to how to be more advanced. That's one of the challenges, putting this kind of information together. And then we'd like to have courses that are outside of WDN that are for sale. So when you have a new hygienist, a new assistant, we can send them places to get caught up, or to at least hear the basic material that some of you have spent 2 to 4 days learning in other venues. And then this collaboration piece. This collaboration piece is huge. All WDN members, whether you're a partner in health, whether you're a medical office, or whether you're a dental office, we have to have an attitude of collaboration. Collaboration is really huge. And when we do that and collaborate with each other, it really gives us a great opportunity to grow. And again, I'd like for WDN members to assist each other. So if you're contacted by another WDN member in your community and you're asked, hey, how do I do this? Or who do you work with in the community? Please, I want you to be in a spirit of collaboration so we can help our fellow colleagues grow as well. And then this community, we have to do a better job, and we're trying to start this community agenda. And we're going to use many different platforms, but this monthly webinar, the forum, the email list, the social media platform, and again, our biannual rally, and seeking out like-minded professionals is going to be really important. So one of the big hallmarks of dentistry and what we have an opportunity for is the opportunity to handle and help manage the cumulative inflammatory burden of the body. And that cumulative inflammatory burden is spurred by and tantalized by, basically, if you will, microbes that live around the teeth. And these microbes, we know now, are microbes that are bacteria, yeast, and viruses. I had no idea years ago yeast and viruses were involved, but that's really coming on strong. So we really want to think about these bacteria, yeast, and viruses. And I can tell you that as dental professionals, we are the only ones that can evaluate this situation around the teeth. So it's really, really great. So as we develop resources, we have this internet-based resource center. It's to create awareness to patients about this issue, not just periodontal disease, but about all these other areas as well. It's also there to guide the diagnosis. There's certain diagnostic parameters that we want to have with each one of these disease entities. And these materials that we create for you should help guide the diagnosis. I have dentists on here and professionals in our network that have written books. I have professionals that are teaching me things. We have professionals of all levels, and we have dentists that have recently graduated from dental school and just want to incorporate some wellness into their practice. So many people haven't been to higher schools of advanced education, and we need to help them start as well. So some of these tools may be sophomoric, but they're supposed to guide a diagnosis. And then they guide the integration of treatment. How do we integrate treatment? And they also guide maintenance procedures. And we have this set up in 8 areas that are directly related to dentistry and 15 that are related to overall health. And the overall health issues usually have a dental association. That's the idea. And it might not be so obvious to some of us, but I want to make sure that I make it perfectly clear as we go along and grow in these webinars, how we can use those. So one of the things that I really would like for people to do, and I ask myself this question, how can our network help our practices more? And one of the things that I thought we needed to do is develop a list, a small list of whatever you think needs to happen in your practice, specific for your environment, that fits for you, and jot down only 4 or 5 things, no more than that. But then do us another favor. Take your list of 5 things and mark 2 of the boxes, number 1 and number 2. And just those are the 2 main things that we would work on. And then include your email address, your name, and your phone number, and your practice name. Send this list to contact@wellnessdentistrynetwork.com, and let us help you. Let us guide you to a resource. Let us guide you to something that you might be overlooking. We know that if you go into the library, and especially if you don't spend much time, it can be very overwhelming. So 2 things. Just create your list of a few and then narrow it to 2. Label them 1 and 2, and then collaborate with a team member in your practice and say, can you help me make this happen? I know a lot of us right now are getting into the digital age, and I'm fighting with a new digital scanner. Well, I had to pick an assistant, and I asked the assistant to get help with the scanner, and I wanted her to teach me. So I said, I want you to learn about the scanner. You reach out, you grab whatever resources you need, and then you can come and help teach me. Because right now I didn't have the time to, I didn't want to prioritize the time to invest in that learning. So this is how we should do this with this in our practice as well. Grab 1 or 2 people from your team, share the vision of what you'd like to do, just these 2 quick things, turn them loose to the network and let us help them. That's the idea. So please send your list, questions, comments, anything you can to contact@wellnessdentistrynetwork.com, and we'll distribute it and see if we can't help you grow in some way. So email us your 2 most important goals, and this is how we think we could advance your practice even a little bit. But remember, the growth needs to be personalized, specific to you and your practice, not to your neighbor's practice or not to somebody else's, and it doesn't matter where you are. I have practices that don't have probes in the exam kits, and you know, one of the basic pieces of our periodontal vision is for every patient to have a comprehensive perio evaluation. But you know, that's different in other offices. Does your office take pan and 4 bite wings as a full mouth series of radiographs? Who do you do that on? Why do you do it on that patient? And is that going to work for you when you're trying to ask the insurance companies to provide more for your patient that deserves more because they have bone loss and periodontal disease? This is some of the things we need to think about. And so we're striving, we at the WDN are striving to make these resources better, more self-instructional, and the questions are going to guide the expansion of this webinar series. This night is the only night that I'm going to do this kind of an intro, because from this point forward, we're just going to dive into questions, cases, and we're going to have these webinars recorded. And from the recorded webinars, we'll have a little catalog of maybe what was discussed on that webinar, like a summary. So if you have somebody new that needs to catch up, this first one will be a good one to have people look at, because it's kind of like an intro. You know, and should be familiar by now with the dashboard when you log into the Wellness Dentistry Network. I'm going to, with my mouse, I'm going to highlight and circle slowly over this Office Forms Tools library. And if you can see my mouse, a lot of us use this box on the library. Don't be shy to go into the other boxes and see what you can have, and especially this Partners in Health box down here. This is where we want physicians and other people to help us learn. So when you do click on the Office Forms Tools library box, what you're going to see are 23 different modules, if you will. We call these modules. And I want to make you aware that 8 of the modules are very specific to dentistry. This is really what you evaluate every day in practice when you look at a patient. However, I've learned that most of us don't have a way of really capturing this data and giving it to our patients in an organized format. Many of you know that I'm involved heavily with the Coy Center, but I have people in our network that are very involved with the Dawson Academy, the Pankey Academy, the LVI, different Scottsdale, different schools of advanced education, and everybody has their own system of paperwork or their own system of organizing this data. Well, in our clinical wellness exam module, we have an organized series of forms that help us give the patient our impression of their personalized assessment that we do at the new patient exam. And I can tell you how valuable that is. But I'm going to get more to that in a minute. The one thing that I think is important is to realize that these 8 areas are areas you evaluate on a daily basis. And every one of these areas has a very distinct relationship to systemic health. And we have systemic health opportunities when we can discuss it. Some are really simple, some are quite a bit more complex. And obviously gum disease is where most people start and where most people have a lot of their early work. So the other 15 are these that are on the screen: heart disease, hypertension, metabolic syndrome, insulin resistance, diabetes, yeast and gut health management, hydration, nutrition. When you think about this, exercise, stress management, supplementation, pollutants in our diet or from our general environment, mold, heavy metals, and then compounding for dentistry. These are the areas that we set up so we could have more advanced learning and we could understand the relationship between oral health and systemic health in a much different, in a much more sophisticated way. So be aware that those are out there, and how you would want to start with these modules is very slowly, and let us help you. So when you break into one of these modules, ask us questions about it, and soon you'll see implementation guides in each module that will give you a little better understanding of why we created it and what we hope to do with it. So the clinical wellness exam, I only want to say 2 things about it, or a couple things about it. It's 8 topic areas that you're already familiar with, but the biggest thing is it's a way to educate the patient, and here's why. It gives a written report, and a written report is critical because of the last bullet point on the slide that says 30 to 60% of health information is forgotten within an hour. So if you spend an hour speaking to a patient, by the time they leave your practice, they've already forgot 30 to 60% of the first half hour of what you told them. They might remember it for a little while, but it'd be very hard for them to go home and remember it thoroughly. And because you're elevating your practice to this relationship between oral health and systemic health, you might want to say a few things to your patient that could overwhelm them. And so we don't want to do that. We want to just give them something simple in writing, and we want to give it to them so that they could refer to it later. It also helps them prioritize what's important. And so studies also show us that 50% of health information is not followed, and we know a lot of it's forgotten quite quickly. So the other thing that the personalized assessments do as part of the clinical wellness exam module is it personalizes the clinical data. And many of you have seen this at some of our personal or some of our live appearances. But when you personalize clinical data, in other words, even if you take out a sheet of paper and write, Joan, I'm really concerned about your periodontal health, or I'm really concerned about, I really want you to use this toothpaste, or I really want you to use some product, a water pick. Whatever you tell them, if you put it in writing, number one, they're not going to forget. Most people are only remembering a couple things. They're not going to forget. But 2, you did something special for them, and it changes their attitude toward what you did for them. And actually, they feel better about the recommendations you gave. They feel more positive that they can follow those recommendations, and it really helps them understand what it is that you're saying. So a hallmark of our whole network is to have small pieces of educational material in writing that are sophomoric, that are easy, that are quick, easy for you to print at your fingertips, that you can give a patient to help them understand the relationship. And you don't give them all this information at one time. You give them a little bit along the way as they develop a more trusting and a more loyal relationship to your practice. That's how you do that. And it happens over time. So I want to talk a little bit about gum disease because I still get the most questions, and we still get the most questions about the gum disease module. And we're going to spend at least 15 minutes looking at a couple questions that have come in, gum disease, because with gum disease, in our teaching and in our sharing of information, I want to make sure everyone has a clear vision of what they're trying to do with gum disease and how they're trying to treat it in practice. There's 5 key components of the comprehensive periodontal examination. And if you have not heard these pieces, or you feel like there's a lack of understanding, or your team's not following along with charting and recording probing depths, recession, and bleeding, and they don't really know what that means, or they're not using case type language, or you're not really organizing risk modification, we could spend a whole half a session or more on just risk modifiers. If you're new to microbial profiling or the genetics of gum disease, this is what we want to help you with. So these are future topics for discussion. So if you need help in these areas, please let us know, and we can start to tailor future webinars around these small pieces. And it's all going to build with a vision, and then it will go, beyond that. Why is gum disease so important? Gum disease, as this particular article suggests, is now tied to 57 systemic conditions that are linked with gum disease. And many of these conditions are now more than associative. We get the question often when we're talking about how oral systemic conditions are related, or how oral conditions are related to systemic conditions. Should I use the word correlative or causation? Well, we have one causation paper in heart disease, but we have mostly associative relationships, and there's bidirectional relationships back and forth. But there's a lot more causation than we have strong clinical trials for, and we know it's out there. So we have plenty of evidence, level A evidence, to tell a patient that if you have gum disease, there's a good chance some other part of your body isn't as healthy than it would be if you didn't have gum disease. That's really safe to say, and that's the idea. And one of the things that we're trying to do in our practice, especially in our periodontal therapists and in our hygiene rooms, is when that patient sits up in the chair at the end of the appointment, you should be able to look that patient in the eye and say, I can assure you that your oral health is not affecting your overall health in a negative way. And if you have a patient that's bleeding, if you have a patient with undiagnosed sleep apnea, if you have a patient with acid reflux, if you have a patient with a yeast infection, if you have a patient that doesn't exercise, poor nutrition, can't eat with their teeth, you can't say that to that patient, and then it would be incumbent on you to help that patient see that you have a resolution, or that you have a methodology to help them be healthier. That's the idea. So 5 key components of gum disease are really critical, and one of the things that I want to talk about, we're going to focus in on one of these as we spend the last 35 minutes or so on this webinar. We're going to look a little bit more detailed at one of these specifically. We have resources in our library that we can print to help patients become aware of why gum disease matters. And if you notice in the beginning of every module, there's a sheet called a practice informational called Health Measurables That Matter. And the gum disease measurable advises the patient that oral health is a significant component to overall health. More importantly, gum disease is part of that oral health. And one of the things that's very important in assessing gum disease are some of these things we can measure. And we want patients to know what their pocket depths are. We want patients to know what their bacterial levels are. We want patients to know how much gum recession they have. We want patients to know these things, and so these pieces of information help us. These are designed for you to use electronically. You can print them and set them up on your in your office. We have them printed. We have them laminated. They're in all the ops, all of them, and we rotate them on a monthly basis, or you can rotate them just how you're using them. And then we have small little teach pieces where we can show a patient a tooth structure, the gum laying next to the tooth, and what the pocket is, and that bacteria live in the pocket, and that this pocket can become contaminated with bacteria. And what do we have today? We have some tests that we can measure. And so that's an amazing opportunity for us. And so that's important in gum disease. But I want to take it to another level, because we're not looking at this just for tooth mortality. We're now looking at it for maybe even a much broader health agenda. If you understand inflammation, we know that the authors of Beat the Heart Attack Gene, Brad Bale and Amy Doneen, who I strongly endorse their preceptorship course, and I've been to many of them, we know that the relationship between gum disease and vascular disease is how the vessel is affected by the gum disease pathogens, the remnants of the pathogens, and how it reacts to the host. That's the idea. So guess what we're coming to? We're coming to a new era in dentistry because we have dentists now that are saying we cannot manage vascular disease for our patients without a thorough oral inflammatory illness evaluation. And the only way we can do a thorough oral inflammatory illness evaluation is if we have an organized, structured format, and if we really recognize gum disease and we start looking at gum disease and the etiology of gum disease, which is microbes, bacteria, yeast, and viruses, coupled with our host immunoinflammatory system, and figure out and become experts in how to manage that and how to manipulate the way we respond to these certain pathogens. If we don't do that as a profession, we're going to miss this opportunity. And I can tell you there's very few of us right now who are out here doing this. And my goal is to get hundreds of dentist offices with expertise, at least a couple people in the office that have expertise in the language, that have expertise in the skill, care, and judgment to know what to do. So I'm going to introduce you to their paper. Brad Bale and Amy Duneen wrote a paper, and this paper basically says something that no other papers say before. We know periodontal disease is generated by microorganisms. We know there's level A evidence about the association. We also know that if they have these high-risk bacteria, AA, PG, TF, TD, and FN, we know these high-risk bacteria can be problematic. How? They can affect lipoprotein concentration. We know that. They can affect the way the endothelium functions. We know that. We have science for that. We have science to show that these pathogens also affect binding in the smooth muscle of the intima. And what's the conclusion of this paper? This is a very brief summary. Is periodontal disease due to high-risk pathogens causal? Is causal. This does not say associative. This does not say correlative. This says causal. This is a very bold statement to be made, but we understand the scientific process. So now guess what's happening? Now we have, in taking it to another level, we have physicians that want us to use molecular diagnostics to look at pathogens that live around the teeth. So I want to make sure everybody knows this is one of the companies that we would use, and now there are actually 6 companies out there, and I'm going to outline those as we grow in this journey together. But right now, the most recent company, I'm spending a lot of time vetting and looking at some of the metrics because some of these companies are measuring using some different thresholds. So this is the Oral DNA company, one of our favorites for our US-based practices. And it's a very easy test to use. Patient swish and spits in a cup or in a collection funnel. You send it in a prepaid mailer and FedEx, and then an email report comes and it lets you know what's going on. The nice thing about Oral DNA, if you haven't seen their most recent report, is it also relates the pathogenic burden with these other health issues that helps the patient understand that, hey, not only is this significant to my oral health in my teeth, but it affects cancer, cardiovascular health, rheumatic arthritis and joint health, dementia and brain health, which is a big one. We could have a whole webinar on brain assessment, and metabolic health and how it affects pregnant women. We have another one called Hain Diagnostics. This is available to people all over the world. This is simply a paper point test, and now you can actually swab the cheeks and you can swab the tongue. You can send this in with again, a prepaid mailer, and you'll get back a result report. And the report looks somewhat the same. I believe there's other tests that look strikingly similar to this test on the market as well, but I have these 2 or 3 in here for a reason. This is now Orovital. Orovital is the company out of Toronto, Ontario, Canada, and Orovital is great for our Canadian folks. It's also great for our US-backed people in some of the states where oral DNA is not allowed. It's also good for anybody in any other state. And here's what I think we should give more thought to. One of the tenets of our microbial management is some kind of antimicrobials. Remember that Orovital makes rinse antimicrobials. And it's not wrong to add rinse antimicrobials to systemic antimicrobials. When you have tough cases and you want to hit it as hard as you can, it's not a bad idea to do that. Also remember that OraVital has a measurement on here for Candida and for strep mutans. Now we know that, and we're going to get into this much more detail in other future webinars, because the purpose of this little intro is not to get into the nitty-gritty of these different tests, but I'm teeing this up for a reason, because we have a very interesting question coming up. But Candida and strep are also implicated in caries, and we're thinking, and we have some WDN members that are using this test with their caries patients to see if there's a correlation between lesions and positive values of strep and Candida. So there's a lot of other ways we can use the OraVital test other than just periodontal disease. But again, it's another valuable tool in our arsenal. And OraVital has recently did a big advertisement, an email blast about testing for risk factors, and they used the statement, according to the American Academy of Oral Systemic Health, that we're trying to become physicians of the mouth, basically. And there was an article in the American Academy of Oral Systemic Health Journal. By the way, I recommend everyone attend the American Academy of Oral Systemic Health meeting. That meeting is going to be coming up in October in Nashville. Come and see us there. It's really going to be a good meeting, and it's someplace for us to continue to collaborate and network together. So I think the question that they asked, OraVital asked in this advertisement, is interesting. What role do you see yourself in your practice playing in the oral systemic connection? What's that going to be? Obviously, you're more interested than most, or you wouldn't be a WDN member office. So this is a very interesting question, and one that is going to get more interesting as we go a little bit further into this program. This is another company that I'm going to withhold the name for right now, but we're looking at 29 pathogens now. We're looking at 29 pathogens, and we're looking at a similar saliva collection system. And why is because I'm working with this company and have a meeting with them next week to look at the metrics and to talk about how the metrics relate to some of the other tests, because I don't want to bring in much more confusion. However, this is going to expand our opportunity potentially. So I will be updating you more on this in the future, and it will be in the almost recent coming months. Maybe by midsummer, we'll have some really good answers and how to work with this company if that's going to be in our best interest. The other thing that I like about the data that this company uses is from a 2016 paper, but basically it looked at bacteria and health. You know, some of even pathogenic bacteria are in the mouth, even in a healthy state. And what this means is you could have bacteria, this paper suggests you could have bacteria in all these different categories at concentrations of 10 to the third and 10 to the fourth, and it still would represent a scenario of periodontal health. So the fact that you have a periodontally high-risk pathogen in your body does not necessarily mean you're going to have periodontal disease, and it doesn't necessarily mean you're going to have some other issue. However, it's starting to get more complicated for what we're being asked to do, and I'll explain that more in a minute. But here's what's clear. At 10 to the fifth, if you draw a straight line across from 10 to the fifth, most only what's hanging around at that point is an overgrowth of health-associated species. You have certain core species that are up there as well, because they populate more. Believe me, when the periodontal pathogens populate, they grow too. But then what happens is the periodontal-associated species outpace the rest of that group, and you have some other variable species that are low-risk periodontal pathogens that are also present. But the idea is these can achieve pretty high concentrations. And that, in fact, is where the cut point is on this test. This test cut point is 10 to the fifth. And so we start to go down the row, and we start to look at variable species. We start to look at periodontal-associated species, and we start to look at other species as well. And as we start to learn more about the segregation of even one category of bacteria, like Fusobacterium nucleatum, what does that mean? There's different versions of Fusobacterium nucleatum, and some are more pathogenic than others. And we're starting to get tests now that separate those out. And that's going to be helpful for us, because we're going to need to do that at some point in practice. So this company, these are the tests these are the bacteria that this company tests for. And these green dots now represent what our oral DNA or more like our oral vital test would have in common with this test, but you can see there are many bacteria on this panel that are not covered by oral DNA and some of the other companies. And I'll help you clarify the meaning of that as we grow in our webinar series. So here's a question, and here's where we're getting to. This is why I needed some background information to tee this up. But I belong to a Brad Bale and Amy Doneen, Bale Doneen chat session, and this is an actual question that came in last week about the oral pathogen testing that's recommended on the list of labs to be done with new patients. Now, this is a physician asking this question. And then the question is this recommended for all patients or just patients with periodontal disease? I mean, what do I do? Do I test all patients in my practice, or do I ask my patients, do you have periodontal disease? Now, let me remind you what the dilemma is for a healthcare practitioner, a physician, asking a patient if they have periodontal disease. We have clear studies that show most general practices are only using about 1% of periodontal disease codes in their practice. So how many of patients in your practice are hearing the words periodontal disease? How many patients are hearing the words, you need more than a regular cleaning? You need some kind of periodontal therapy. If it's only 1%, there's not a lot of patients that are going to walk into their physician's office and say, yeah, I have periodontal disease. But guess what's happening? The physicians are getting much more savvy, and they're starting to bring hygienists into their office. They're starting to work collaboratively much more with dentist offices, and they're identifying those patients that have periodontal disease. And then they're asking the question, the physician's asking the question, what company do you recommend, and how should the specimen be obtained? Thanks very much. Here's the answer that came back. Oral pathogen testing is recommended on everyone, regardless of the clinical exam. This is a conflict for us. It's not a conflict for us, but it presents a conflict in what do we do with the data? And here's why. These pathogens can be present even in the absence of visible periodontal disease. We know that as a practitioner because there's two main things that create the progression of periodontal disease. It's the biological makeup, the microbiological makeup, and it's the host modifying factors for the disease. So we know people come in with high levels of pathogens that don't have periodontal disease. But now what are we going to do? Because maybe they don't need scaling and root planing. And as the definition, we've set it up earlier for tooth mortality. So of course, it's imperative for any patients at moderate or high risk for cardiovascular disease, diabetes, dementia, and chronic disease. Why? Because there's this causative and directional relationship with the vascular system. You know the vascular system serves cardiovascular disease or cardiovascular health. That's your heart. We also know it serves your brain. It's also significant in diabetes. So what do they say? And what was the answer? There's two companies, Oral Vital and Oral DNA. We know that we have a company in Canada, Oral Vital, and we have Oral DNA here in the States. There's another company, Hain, and it says we don't recommend this one, but you'll run into some colleagues who still use Hain. It's one of the first companies to offer testing, and there's some other problems. Look for a forthcoming video on this topic. I can tell you there's 5 companies. There's more companies than just 2, but there are nuances working with these companies. So I think you want to pick the easiest one to work with first so you can start to get an idea. But let's evaluate this further because now the plot thickens a little bit more. Second question. This is now from a new practitioner, but this is again from a physician. I want to need some feedback on how to proceed with a patient who's resistant to having a deep cleaning of her mouth done. Why? Because she has absolutely no oral symptoms. She maintains excellent care of her mouth, twice daily brushing, daily flossing. Her husband's an endodontist, does not understand the Bale Doneen training, not interested in learning about it. And he has done several oral treatments with varying results. So she has some other things. ApoE3/4 means she has high risk for probability for Alzheimer's. She has a dyslipidemia because she has elevated lipids. She has elevated LP-PLA2, which is a measure of disease activity. So we know she has some atheromatous activity or inflammatory activity in the vessel wall, despite her excellent diet and exercise regimen. We know people that are in excellent health die. Everyone who's been in a live course with me knows about my story of 3 people in 2013 dying on the course when I ran my last marathon. So we know people with excellent diets and exercise can have disease. And then he goes on to say, he or she goes on to say, no plaque, a coronary calcium score of 0, BMI of 18.5, does wear a sleep guard for TMJ. And then here's what's happened. 3 oral vital tests on her, see attached. I didn't see the attachments, but I don't need to because they're explained. After the first test, her husband came to the appointment and we discussed treatment. Obviously, there were pathogens. I have not seen great resolution with FN despite aggressive treatment. This is what the person realized after she and her endodontic husband came and they did some kind of treatment. And since we don't know whether what was tested is the worrisome FN, I don't want to get bogged down right now in the 5 species of FN that are in the FN measurement on the oral DNA test, or maybe on the oral vital test. That'll come clear in a future webinar. But the remainder of her results did not look horrible, so she just has elevated FN. And her husband asked, could I just put her on a chlorhexidine rinse for a few weeks and see what that did? Well, they agreed to that, and they said, and she also reminded her to disinfect her TMJ appliance. I think that's a good idea. So the second post-test is chlorhexidine, and you can see the results got mixed. Some are worse. The candida appeared. So they started to share a lot of information with the patient about the link between ApoE4 and pathogenic bacteria, and the patient starts to lose confidence at this point. She says, I appreciate the information, but I'm still resistant to have more aggressive dental treatment. Why? Because I don't need scaling and root planing. And then they start to lose faith in the dentist that's trying to work with this patient. The husband insists that the bacteria present are normal as part of the normal flora. We do know they're normal. However, they're not normal at elevated levels. And that's part of what we have to struggle with. So we go on to see that the physician now is asking. The patient also questioned if the chlorhexidine could have disrupted the normal flora of the mouth, thus enhancing candida growth. You know, chlorhexidine is antifungal, virucidal, and antibacterial. However, it doesn't attack all periodontal pathogens. It's not the best rinse. It surely has a low pH. And I can't say whether that would happen or not, but there's a lot of other things happening. So at this point, she wouldn't see a Baldwin dentist, but would consider treatment through her, but also resistant to more antibacterial type treatment. So what would happen if we took a different approach? I gave her a dental probiotic. So now what we have is a physician trying to throw this stuff at it. In other words, I don't know if it'll work. And she asked her to chew this and chew it with xylitol or stevia and asked her to continue her care. The third test now demonstrates results after this 1-month trial. Some things are better, some things are worse. Candida remains. Any symptoms of bleeding, pain, soreness. So here we have 2 things going on. We have a physician trying to treat to a test that's showing high levels of bacteria. We don't have a fantastic understanding necessarily of what that means, but I can tell you doing anything for a couple weeks, doing anything without a more aggressive, thorough disinfection protocol, no matter what the oral tissues look like, is not going to be successful. And so how does she conclude? Without having good trials or specific regimens to recommend, she doesn't want to continue with any oral treatment, much less insistent that she see a Baldwin dentist for periodontal treatment without having any symptoms. So I'm at a loss how to direct her. And I've recommended the oral vital protocol on the results to patients for the past year, but I'm not doing this anymore. Why? Because I haven't seen much change in the results. I can tell you when I started to treat patients this way, treating them with the odd rinse, trying to treat them with some, haphazard, untested modalities like different probiotics, I had the same kind of results. They were spotty, haphazard, not very consistent. So I'm definitely hesitant to have her do this because I can't say that it works. Well, I can tell you what, the oral vital test works. It's accurate. You didn't move the pathogens in this patient's mouth. That's exactly what happened. And so, and you mixed it up a little bit, but you never really got it to a conclusive endpoint. And I can tell you some of these patients are hard to treat. So I completely support the idea of the connection. I'd like some feedback. So as we go on and look at this, I love Mike Martin's answer. And this is Mike Martin, one of our Wellness Dentistry Network members, because look what he says. It's challenging from a technical and a behavioral standpoint. When patients lose faith because you don't get good test results, because you don't initiate a really thorough kind of proven methodology, that's going to be difficult. And what do we end up doing? We lose faith in our tests, we lose faith in our treatment ability, and we're just as stranded. As a matter of fact, we're more stranded than before we started because now we don't know what to do. And Mike says, managing periodontal disease, you have to eliminate the pathogens and repopulating the healthy flora. That's absolutely correct. However, I would say the healthy flora will repopulate on its own as you start to eliminate the periodontal pathogens. It won't happen overnight, and if the patient's harboring biofilm below or gum line, this is a beautiful, 100% accurate statement. If you fail to mechanically and chemotherapeutically both disrupt it, it will compromise your end result. This patient, we have papers that show pathogenic microorganisms live way beyond the teeth. They live in the mouth and other places, and no rinse that I've ever used works only in 2 weeks. Remember, the average time to stability in our practice after doing multiple rounds of testing is 4.5 months. These patients have to work at this a lot longer with much stronger chemotherapeutics before they expect any kind of end result to be decent. And so he says, Mike says, we typically use an FDA-approved bleach rinse. He's talking about the CTX4 treatment rinse. That's our chemotherapeutic. By the way, if you're in another country, we know that the Jorgen Slots paper that's in the library, low-cost periotherapy paper, you can look that up. It has recipes for how to make your own rinse. This is really a nice way to do this. And as our chemotherapeutic, an appropriate antibiotic plus mechanically disrupting the biofilm with SRP is critical. Also, I love Mike's reminder that there's better rinses than chlorhexidine. That's great. And then he says 4 to 6 months of hard work. Mike, I love that. It's so true. That's exactly what we found. And I think if you start measuring metrics, you'll see the exact same thing. And anytime we let our patients off the hook earlier than that, now remember, that's average. So you have some patients that are going out 10 months or more. We've had some patients rinse with CTX4 rinse beyond a year. So you got to do what it takes, and you got to continue to work at it until you get that pathogen load where you need it. There's no problem with the test. There's a problem with timing of taking the test and what we're expecting the test to do for us. That's the problem. So I want to give you one communication tip of the month. We'll go through this quite quickly, but it's about bleeding. So for our teams who might not be so sure about what to say about bleeding, remember, in our work, we use the Papilla Bleeding Index. And for ask your practitioner or ask your team or remind your team about line bleeding. But one of the problems is we have a patient that's bleeding. What is bleeding a sign of? It's a sign of inflammation. So what do we need to do? At that point, we need to let the patient know we're concerned. You have to decide in your practice how many bleeding spots you want to let go in your practice before you start to give your patient more information about how they can bleed less. I ask all my teams, do you think our patients have a learning disability, or do we have a teaching inability at giving them various modalities to learn how to make the line bleeding go away? Why do I want the line bleeding to go away? Because it's a sign of inflammation, and we know inflammation can be dangerous. And so we want to get rid of that. So how about this? Line bleeding is just a sign of inflammation. If you just simply said that, and if you look at the top picture of the teeth, you don't see recession, you don't see big problems. If you look at the bottom picture of the teeth on the right side of your screen, you see all kinds of bleeding, interproximal bleeding, and this is in the anterior region. You know periodontal disease is a disease of the molars. So one of the things you can tell your patient, line bleeding is a sign of inflammation. Have them look over at the book that's on your bookshelf or on your windowsill called the inflammation syndrome and say, we know it's related to overall health. It's a great way to say it. That's one way of saying it. And remember, I want you to find your own words. How about you're bleeding more than I'm comfortable with and it's not normal? You just don't have to say anything after that because they'll realize it's not normal. So you're bleeding more than I'm comfortable with. It's not normal. It's a great way to generate more conversation with the patient about bleeding. How about explaining a little bit more about what bleeding is? It's a result of your body's reaction to the bacteria, yeast, or viruses that live around the teeth. Oh, really? I didn't know I had yeast, viruses, or bacteria that live around my teeth. And then you can generate the next line or statement. That's why we have professional debridement to help remove that. So these are nice tips for hygienists to start to figure out how to say certain things. Or what about our concern for bleeding? Our concern about bleeding is not just for the teeth, but now we know the biofilm or this biofilm or slime layer initiating the bleeding may be related to over 50 other diseases. I showed you earlier it's 57 and counting, but you can be very confident letting the patient know that this bleeding is a sign that something's awry and it's related to over 50 other diseases. And what's our goal for you when you leave our practice? Our goal is for us to be able to look you in the eye and say, we are confident that your oral health is not contributing negatively to your overall health. And what's our goal for our patients? We want all of our patients to achieve zero bleeding. So perhaps there's more we can do for you. Not you could do more for yourself, not you have to brush better, you have to floss better, but you know what we can do? We can do more for you. We can give you tips, hints, ideas on how you can do better biofilm removal for yourself, and we can help you. So I hope this little piece provides a line, an idea, a concept that can help somebody talk more comfortably to their patient tomorrow about bleeding, about the meaning of bleeding. And remember, there's resources in the library for you to print and hand to a patient that lets them know about why this bleeding is critical and why we want the absence of bleeding could be positive for their overall health. How about moving beyond the mouth? Is there one tip now that I could give you as we move beyond the mouth to use one piece in the library? Well, I'm going to move beyond the mouth to exercise. We have a vision that we want all of our patients to exercise a little bit. We have a health measurables that matter that explains exercise. We have a little piece called Why Workout. You can print and help your patient understand why they should work out. And we even have something for the patient who says, I have no time. Well, you know what we have? We have a 7-minute exercise. You don't have 7 minutes? If you have 7 minutes, you could get something done and it could be helpful. And guess what? You could do it in your gym shorts. You could do it in your sports bra and your bare feet if you want to. You could do it however you want, and you need no supporting material, no supporting gym. You need nothing but a chair in a hotel room or a small space. So this is really, really easy. So we have a health measurables that matter. And again, we print these, we put them out. And what does this do? It asks the patient, it initiates a patient question. Patient question would say, how is physical activity related to oral health? Well, let me tell you, there's nothing that can increase your cardiorespiratory fitness more than physical activity. And when you have good metabolics, remember diabetes is a metabolic disorder. When you have good metabolics, your gums are going to be better. So there's no question that exercise, even physical activity, has a play in our oral disease management and for sure for our metabolics. So we have a thing, why work out? We list the benefits of working out, and we talk about some of the statistics of premature death, diabetes, and heart disease if you have poor fitness or if you even maintain some minimal activity, because this can lower your risk significantly. So you know, if in your library, these are personalized for you. So start printing these pieces off. But these are the kind of things you should find in these modules that help you educate your patient. And then if they want something, they say, how can you help me with this? We actually printed this and handed this off on last Tuesday, I believe, would be this. This is a time saver, high intensity fitness circuit. This is a 7-minute series of 12 exercises, 30 seconds on, 10 seconds off. It's a really, really nice little 7-minute exercise. It is high intensity. So for somebody who's not very fit, we want to make sure they're careful, and we want to make sure that they take appropriate precautions when they're doing these types of exercises, but it's really easy. Number one you can see is 30 seconds of jumping jacks, followed by a 10-second rest. Number two is a 30-second wall sit. That's not so easy to do, with a 10-second rest in between. Then you'll have push-ups, abdominal crunches, step up onto a chair, squats in place, tricep dip off that same chair, a plank, just a plank stand for 30 seconds, high knees running in place, a lunge, a push-up with a rotation, 30 seconds one way, 15 seconds one way, 15 seconds reverse, go the other way, and then side plank, 30 seconds for side plank and a 10-second rest. 10-second rest. 7 minutes all in all in total. And if you get good at it, you can do 2 circuits, 3 circuits, 4 circuits, and you can build up quite a little workout with no gym support and not even leaving the confines of your bedroom. So it's a really nice thing to do, and there's really no excuse other than lack of prioritizing that prevents people from exercising today. Additionally, there's a nice app on the phone. You can see it circled here. It's called 7. And the 7-minute exercise, you can download it. It's free. And this app will have a little coach there with a timer. It reminds you when your 30 seconds is up, when your 10-second break happens, and what your next exercise is. It's a really nice feature for the 7-minute app. And yes, this high-intensity circuit training is research-based, and it does have some research behind it. But remember, it's high intensity. And so if you're not able to exercise, or if you have some limitations either in fitness or in body movement, make sure you tailor this activity to fit just what you can do. If you're doing push-ups for 30 seconds, you can only do one. Do them on your knees. Modify the exercise so that you can gain strength and build ability, and soon you'll be able to follow it the way it was designed. So that's a little tip on moving outside the mouth to look at one of the other modules in the library. So as we start to close, I want to remind everybody that our next webinar is going to be Monday, June 3rd, 2019 at 8:30 Eastern Standard Time, which is, I guess I put 5:30 PST. People know that I have family ties in Seattle. However, and I'm in Michigan. However, we have people all over the world. So I want to make sure that people can log on, and these are recorded, and so you can always listen to the recording. I decided not to do an active video so that people could listen to it somewhat as a podcast if they wanted to. But again, listen to it any way you want. I would love you to forward your questions and comments to contact@wellnessdentistrynetwork.com. It's important. Attention inside the Wellness Dentistry Network. We want to get your questions online. We want to find answers for you. We want to help you grow, but I need to know what you need. And so that will help us a lot. Also, reminder, please forward us the email addresses of your team so we can invite them to the webinars. We can invite them to other community events. I hope some of my team are spending a few minutes looking in on this tonight so that they can come in tomorrow and say, I even picked up something off the webinar last night. That's the idea. So without your team being engaged, remember, if you're the owner of the practice, if you're the lead associate in the practice, if you're a team member in the practice and your leader's not here, remind each other to get in here, and if we want to start benefiting our patients the most, we need to learn this information, ask some questions, and we'll help you. That's really the idea. So 3 critical points. I close most of my programs with this comment because I think it's so true. 3 critical points about why this process, why this whole wellness movement is successful. And we can talk about all kinds of aspects of this, but we know that this framework has become the key to my integrative oral medicine dental practice. And 3 critical points about why this process is so successful. It just happens to be unique. It's really relevant. It's absolutely relevant, and it just so happens to be true. So I just love these ideas, and I think this is what makes it timeless with no regional boundaries. So in closing, I want to thank you for your efforts to bring health opportunities to your patients. I want to thank you for being networked with us. I know that this continually doesn't fit for everybody, but I hope we can gain more members, get stronger as a community. And remember, as one of my good friends, Boley, reminds me, and I've seen this many places now, a healthy man has a million wishes, a sick man only one. I wish you the best in your journey to a wellness practice, and I wish you the best in your health and wellness as well. Thank you.